Hi, welcome to the Teaching Selective orientation in the problem-based learning setting. The objectives of this module is to review the Teaching Selective requirements from the PBL setting, review some techniques for providing feedback, and review your independent learning plan assignment. So from your perspective, the objective that most directly applies to you in the problem-based learning course is to demonstrate useful techniques for teaching small groups on words or teams. When we look at the feedback process, looking at feedback as a process with the purpose of identifying a performance gap, each component is interrelated and interconnected, as you see in this picture. Setting expectations or objectives helps the whole process. It drives student performance because they know what to focus on when they have to perform. It drives what you are going to watch and observe and provide feedback on, and it helps identify a gap in the performance from what is the intended level of performance versus the actual observed level of performance. And that's what we want to narrow, is that gap in between the intended level and the actual level of performance. So a process for providing feedback, one, you're going to set expectations. Two, you're going to ask the learner to perform, and you're going to observe the performance. You're going to ask the learner for their own perspective and invite critical reflection on their performance. You're going to discuss the gap in the performance and investigate the learner's frame of mind so you understand the drivers behind the behavior that you observed. And then you're going to help them close the gap by negotiating a learning goal. So if you look at the setting expectations checklist from the M4 Teaching Selective, clearly explaining the learning process or activity is important. Explaining the expectations to the learner so they know clearly what is expected of them. You can do this during your first session with negotiating some of the group norms that happen in PBL, the role of the learner or the leader, the reader, the scribe, who has a learning objective, when they need to post the objective, the learning issues, etc. Why something is important, and taking into consideration the learner's current level of knowledge when you're teaching. So this is on the actual form. But in PBL, the 200 level, what we're looking for is for you to help the learner develop clinical skills of synthesizing and assimilating patient information, making case presentations and developing a differential diagnosis. Give the students an opportunity to practice presenting their learning issue as if they were presenting on the wards or in a clinical setting. Ask them to develop an organ-based problem list and differential diagnosis based on pertinent positives and pertinent negatives. Students should be able to prioritize and adapt their problem list based on, and their differential diagnosis based on how the case changes or new information. Then ask the students to provide their rationale for their choices. So for example, what tests would you order and why? Looking at the Teaching Selective checklist again, communicating effectively, here everyone should be fine in the first view. I would focus on engaging the M2's ability to engage their peers and whether they actively listened and adapted their needs to help someone else understand a concept. Pertaining feedback, the one thing I want you to take away from here is ask the learner for their own self-assessment, what they did well in an area they could improve on up front. If there's something specific you observed, ask them why they did something. This is really important because and probe for their rationale, because if you can understand the logic behind what they did or why they did it, you can correct a misconception, you can correct a knowledge deficit. Sometimes people do things for logical reasons, and you can help understand. And if you ask that why question, you can understand that and fix the behavior. Be specific in your feedback to the M2s. Identify areas of improvement from your perspective and positives. Provide an example for them on how to improve. Possibly give them a take-home message. The one thing I want you to remember from this is, and help them develop their next learning goal. So help them negotiate with them what they're going to do next. Knowledge integration. Pay attention to and provide feedback on when, in a positive way, when the M2 integrates what they've learned in their coursework or clinical settings to the PBL case. Here are some examples based on the advocacy inquiry model of providing feedback for you to utilize. So you might want to say, I noticed that you did this in your presentation. I liked it because of another reason. How do you think you did? Do you agree? Do you disagree? I saw that you did this in your concept map. I thought it was interesting the way that you presented it. I was wondering what your thoughts are. There's a whole list of things you can go through. Another thing that I've used in the past is the perceptions versus intent. So I saw you do X. It gives the perception of, is that your intent? So these are just some examples of some wordings that you can use in giving feedback. So part of your assignment is in the M4 Teaching Selective is to develop an independent learning plan. And that plan is based on your teaching skills. So what I would like you to do is to send me periodically your written feedback to your students if you're providing written feedback. I'd like to look at that feedback with you at the end of the term along with your independent learning plan and discuss from your perspective what went well and what didn't go well. The components of the form include your strengths of teaching, your areas of improvement where you'd like to teach, your goals. If you're thinking of a SMART goal, it's specific, measurable, attainable, relevant, and time-bound. So in what time frame are you going to do this? A plan for achieving the goal, and then the evidence for how do we know that you did it. So this is required. This is an required part of the Teaching Selective, and this needs to be turned in. And I would like it if you would turn it in to me, and we can meet and talk about your feedback that you gave and your independent learning plan at the end of the PBL unit. Some resources, you've had lectures on feedback. This is just an additional quick overview. There's some materials in eMERGE, and I believe the Teaching Selective overview was recorded, so it should be in eMERGE as well. And then I'm adding a slide on concept mapping, so please don't forget to concept map. This is just a template that you could use to start concept mapping a case. Students should be familiar with it, but just as a reminder to continue using concept mapping as a way to teach. And so in summary, what I would like you to do is to set expectations throughout PBL, especially up front, negotiate the norms and what you expect in PBL from them, but then during every session, start with setting expectations for that session. Give feedback, and when you do it, invite the learner's own perception. So ask them to critically reflect on how well they did. Identify a performance gap. Investigate their frame of mind. So ask them, again, for their rationale, for their justification for why they did something. And then close the gap, and you can do that through setting up a learning goal or their suggested next goal steps for them. And then for you, for your requirement, you need to create an independent learning plan that's anchored to your teaching performances. And through this whole process, there's education. And if you need help, please contact myself, Elizabeth Ryan, and we will set up an appointment for you to come and talk about your teaching. And there's my email address to send me some feedback and touch base with me about how you're doing throughout PBL. And Jessica Voth, the curriculum coordinator. Thank you.